All right. Well, thanks everybody for being here today. This is the inaugural panel for public administration and looking at the various career tracks that our alumni and current students are engaged in. So I just want to, have some discussions about what people are doing in their particular fields and how public administration theories and concepts kind of relate to the work that you do and can be helpful in helping to solve problems and things like that. So just to be clear, we have our panelists here, Ashley Hemrich and Claire McCray, and I'm going to let them introduce themselves here in a little while. But just to be clear, we are going to record this and publish this on the MPA YouTube channel, as well as in other places as well, just so people are aware of that as we go into it. So hopefully, the information will help to inform, prospective students about the kinds of careers involved in, or help current students as they're kind of working through where they might go with their degree. So with that, I'll go ahead and have our two panelists introduce themselves, and start with Ashley, who's actually here in the room with me, and then we'll go to Claire afterwards. So Ashley, if you just want to kind of introduce yourself, talk about your current position.
Sure. I'm Ashley Hemrich. So I work for HRC, which is a human resource center out of Edgar and Clark County. I am currently the access director. So any services you are going to need in Edgar and Clark County, and now even sometimes in Indiana, you're going to have to go through me directly. A lot of my work deals with therapists. So I do all this therapy scheduling. I take the clients into the scheduling for those individuals. The majority of it is, putting people in schedule and bypassing them to the right departments and things that they need. I work with so many departments, and it's really interesting to have so many different facets that I've learned with Dr. Myers over the years.
All right, thanks, Ashley. And Claire?
Okay. Yeah, hi, my name is Claire McCray, and I am currently the district manager for the Bureau of Disability Services. I've had this role for about almost 3 years. I can't believe it. I've been with Beads for 7 years now, and I love it. So what we do in Beads is we serve people with intellectual or developmental disabilities. I have 8 service coordinators that I manage here in the office, and we have 16 counties that we serve. And, basically I just oversee the daily operations of the office as the manager.
All right, thank you very much, Claire. And I don't know if I actually introduced myself or not at the beginning. So my name is Nathan Myers, and I'm currently the director of the Master of Public Administration program here at Indiana State University. So I've had the pleasure of having both Claire and Ashley as students in the past, and they were nice enough to agree to share some of their experiences with us today. So basically, in terms of the format, I do have a few sort of pre-written questions that I'll go through, but I know that we do have a few people who are online to view the panel. So if you have any questions, if you could kind of chime in or write something into the chat indicating that you have a question, I'll be more than happy to recognize people if they have their own questions they want to ask. There will be a period specifically at the end or toward the end after I've run through my questions. But if people have questions along the way, or if you have to leave early and want to ask a question, feel free to let me know in the chat or to chime in at any point. So with that, I'll go ahead and ask my first question. So we'll kind of go in the same order. We'll go with Ashley and then with Claire. So if you can talk a little bit about kind of the educational path that led you to your current position, and as well as any kind of previous professional experience that kind of led you to your current job.
Okay, so in 2015, I went back to school. I went to ISU for the political science program, and then I graduated. And in 2018, I came back for my master's. I was a GA for the 2 years while I was here. Prior to any of this, I had no experience in public administration. I was always a waitress, always in the service industry. So I had no background in anything that I was going into. And so when I graduated at COVID, so COVID hit 2020, my internship, I was doing an HR internship at the place I work now. And the position opened up. And so I applied for that position. So I went from my master's program to my internship right into a position in mental health and substance use. And we do have a DD population, but I had no prior experience. And so now that I've gotten to where I am now, having my master's is really beneficial. And then I also just finished my PhD coursework with St. Mary's for their global leadership program. So having those types of master's program and the PhD program that I'm in now has really been beneficial for me, allowing me to start as an intern to the access coordinator to different supervisor positions to where I'm the access director now. So anybody coming in, you go directly through me. So it really wasn't until 2015. And then I have been in school for the past 10 years doing everything to get where I am. So you don't have to have prior experience in this program, like NPA, anything like that, to get to where I am. And that's what I want people to know is you can just walk into it after your internship and you learn the rules, you learn the procedures, the policies, and you can get to where I am at now.
Thank you, Ashley. Claire?
Yeah, so I am a little bit older than Ashley. I graduated with a bachelor's in sociology in 1998. And then I had a career in social work for many years. And then I went to graduate school, actually the same year that my daughter went to graduate school. She kind of gave me incentive to do so. So I started in January of 2020, and then COVID came and I was like, oh, what am I doing? But that's when I started the program. And the years of being a caseworker and just an entry-level social worker, I wanted to get some administrative experience and some administration under my belt. So I felt like the MPA program was going to be beneficial for me in regards to that, because I knew I wanted to stay in the social work field. I just had never been an administrator. So that's why I joined the MPA program. And, so far it's really helped me in my role as a district manager. And, who knows what it'll lead to in the future for me.
Great. Thank you very much. I just wanted to ask a quick follow-up question, since you both mentioned COVID and kind of how that was a significant part of both of your experiences. Do you think the circumstances surrounding COVID and kind of your experience with it, do you think that in and of itself sort of directed you in some way towards where you ended up career-wise? Do you think that influenced your thinking in terms of pursuing the position or anything like that? So Ashley.
I would say yes, just because when we were doing the GA role, we were playing the game pandemic. And we joked, this would never happen. And literally less than 6 months later, we had the pandemic. And so it was always one of those things where I was thinking maybe I would go into, public health or something like that. But when I actually got into public health, like So like my wait list for people getting services over 600 people just trying to get in for mental health services and sub services. So starting in public health and then getting into the public health sector, absolutely, without the background here and that knowledge from pandemic, even if it was just a playing game, it literally moved me right to where I needed to be.
Yeah, so just a point of clarification with what Ashley was talking about. So Ashley and some other graduate students and undergraduate students, we actually did an educational simulation, kind of looking at different scenarios involving a pandemic, and this was before COVID-19 hit. So it was designed to sort of take a board game and figure out how we could use that board game to like do different exercises to get students to think about different scenarios. If this happened, how would you respond? And a lot of those scenarios ended up playing out, unfortunately, during the pandemic. Yeah. So just to clarify, we weren't just playing pandemic for the fun of it. There was like an educational component. But Claire, as far as kind of how the pandemic sort of shaped your trajectory, if you wanted to comment on that.
Well, I mean, here at Beads, I mean, COVID, I mean, I did have to work from home during that time for 15 months, but I also had to ensure that our individuals, like in our group homes and in our waiver homes, were still safe, because we had to do a lot of shifting around in the group homes because COVID, you know, a couple people would get sick, and so we'd have to move those individuals out. We had to make sure that all the individuals got their COVID vaccinations. So I would say that, yeah, it definitely helped with making decisions like that for me.
In terms of your decision to kind of apply for the role that you have now, did it shape your thinking about whether or not you should do that?
You mean with COVID going on?
Yeah, just that experience, did that shape your thinking at all?
Not, not really. Because COVID was still going on when I applied for this position, but it was, I really didn't think about, just everything that we had to do, all the protocols and everything and the restrictions and stuff. It was just kind of our day-to-day function, how we were, everybody was functioning. So it's kind of just the way it was. And there's still things that are, put in place that I don't know if they'll ever change,
Yeah, absolutely. So the next question I had for you both was, what is the most rewarding thing about your current position? So Ashley, we'll start with you on that.
There are so many things. The most rewarding thing is I get to help people. I get to help people who normal people would just turn their nose at or turn them away. Individuals who are really in need, those who actually have to get their things done. And I have people coming in who don't have on socks or shoes or don't have on, some of their clothing is missing and things like that. So I get to help these individuals find housing, find support, find the things that they may need. And so that's the biggest thing. I never thought I would go into a career where I'm helping so many individuals on a day-to-day basis and loving every aspect of it. So the people, hands down, the people.
Okay, Claire.
That's great, Ashley. I also get that same reward. We serve a lot of individuals that don't have anything, and on top of that, they're suffering from an intellectual disability. But what tops that is when I hear a success story about that individual. They could have come into the worst circumstance, and I get a phone call from their guardian or from somebody, a provider that's been helping them. And they tell me that they found them an apartment, they got them a bed, they got them a dinner table and, a chair, and they're happy as larks. And, to me, that is just the simple things, because that's, to them, that is like $1 million, a bed and some food and a TV, you know what I mean? And that's really all we need, to be honest with you. And I also like to hear success stories from my service coordinators when I see their happy faces and them telling me of success that they've had out in the field with a family. I know they're doing their jobs. I know they're treating our individuals with care and compassion.
Very good. As far as the level of need experiencing in your positions, have you seen any change in the level of need since you took the position? One way or another, has the level of need increased, decreased? Have you seen any changes over the last couple of years?
Yeah, definitely an increase. I would say that we have a lot more individuals who don't have housing, who do not have insurance, who do not have ways to feed themselves. I think that's a big one we have right now, is those, like the housing, feeding, those types of things. Previously, it was more of like the services they were needing to get done for court, or like their DUI evaluation, things like that. But now we have so many other individuals that we're referring and putting in like a donated funds initiative to where we can get them the things that they need and help pay for it. But COVID did a really big number on those in our fields, in our population. People really need just general necessities, things that we take for granted on a daily basis.
Okay. Claire,
Yeah.
did you have
I would say that mental health, I mean, we don't serve individuals with, mental health disorders, but we serve people with dual diagnosis, somebody that might have an intellectual disability with, depression or something like that. And so we just see people come in here with so many mental health disorders and need help, and there's just not enough providers to cover mental health around. There just really isn't, and there's just so much mental illness that I see people come in, and we can't serve them because that's all they have is mental illness. It's really bad.
Okay. Thanks for providing that additional information. It kind of segues into the next question, which is what is the greatest challenge or the greatest challenges involved in your position? I think we've already kind of started to get into that a little bit.
I would hate to say this, but sometimes people are sometimes my greatest challenges. Funding's a big challenge. Laws and policies are really big for us. But funding's a big one for us, because I work for a nonprofit, so we are fully grant based. So everything that we do is literally gone through our boards, everything like that. So funding is huge for us. And individuals, sometimes you can't help individuals, or you have to hold some boundaries with some individuals and they aren't happy with that. A lot of the individuals we serve are from like parole, probation, and juvenile justice system. And so it's hard to help them understand the process of way things go without them being upset and, doing those types of profanities with us. But I would probably say funding, people, laws, and policies are really big ones that I come into issues with all the time.
Mm-hmm. Yeah, that's pretty much where I'm at too. It's a lot of red tape in government and there's put a lot of constraints on what we can and cannot do. And I do a lot of talking to I do get a lot of phone calls from parents of individuals, and they want a perfect system, and unfortunately I can't I can't provide a perfect system. It doesn't exist. All I can do is just explain to families and guardians that the services that we have, this is what your budget, calls for, and this is what the service provider is supposed to be using your budget. This is the allocation that you're supposed to be receiving, and that's another thing is there's not people to work for these services. And that's a lot of times that's the complaints I get is nobody showed up to work the shift. And, so sometimes our group homes have people that are unattended because there's nobody to work the shift. So since COVID, I guess I kind of forgot to mention that since COVID, there's been lack of staffing. That's, for our individuals. So I hate when I have to tell a parent that I'm sorry, I wish I could tell you more. I wish I could tell you more, but this is just what our service offers. It's really hard to disappoint. I feel like I'm disappointing someone when I have to tell them that this is what it is, It's just not a perfect system.
Yeah. So a follow-up question on that then, if there was one, if you could, wave a magic wand or whatever and say, this is or you could talk to, the governor or people in the legislature or what have you, and say, this is the one thing that we really need more funding for, or this is the one policy change that we really need, what would you say in terms of either funding priority or policy change or even both?
Policy, being able to give care and coordinate services over government lines. For the longest time during COVID, we were not allowed to treat Indiana clients just because we could give services over state lines. So policy with that type of thing, giving services over state lines or coordination of care, a policy of coordination of care for pandemic relief or for certain situations. I think that's a big one. Coordination of care, allowing us to serve clients regardless of where they are.
Claire?
I would say a big one for beads is so there's a waiting list for one of our waivers for the family support waiver. And that waiting list is 36 months. You have to wait for 36 months until you receive services. That's a long time for an individual to wait. It's very disheartening when we have to tell a parent, oh yeah, you have to wait for 36 months till your child can have services. So I would definitely think that they need to address that.
Okay, thank you very much. So kind of turning a little bit more into like the public administration side of things. You're both graduates of the Master of Public Administration program. So what concepts or theories or information that you gained from the program have you been able to apply in your current position?
I would be lying if I said I had 50 off the top of my head, but I'm like, what are some of the concepts I remember from public administration as I'm Googling this? But hands down, one of the main things and the first thing that I was taught, accountability. Accountability is always going to be my main thing that I go to 100% now. Being accountable in what you do, saying what you're going to do, and making sure that you can back up what you're doing. I think that is the hands down the one thing that I have learned and I've kept with me for the past 4 years is accountability and just learning to get the science behind things. So I can work in mental health, I can work in substance abuse, I can do these type of things, but why are we working these things? Why are we doing these things? Why are the policies this way? How can I change the policies? And that's what I'm constantly doing. Prior to like taking classes with the MBA program, I never thought like this. But now I'm like, how can I change it and make this better? How can I make these people accountable for what they're doing, but still make it to where you want to give them services? So hands down, accountability, decision making, you know, managing programs and policies. I will go, that's what I'm going to say, hands down, 100% accountability.
Claire?
Yeah, I think that policies and procedures, you know, that's how my daily day operates. I mean, I have to follow policies and procedures on how I guide my employees, how I treat the individuals, how I talk with families, and I also believe in accountability and, you know, following direction. You know, another thing that kind of sticks out to me from the program is, I think this was in a different question, but I'm just going to throw it out there, was the class that we took on, I think Dr. Buchanan taught this class. It was the Constitution, learning the Constitution. For some reason, that to me was really interesting because I did not pay attention as a high schooler. It didn't interest in me at all. But this go around, it was important to me as an adult to learn that, to understand the concepts of the Constitution. And it's important that as US citizens that we do understand it. So anyway, it gives me cold chills when I think about it. And it's just empowering. So yeah, that's all. I'm sure there's more, like Ashley said. Like I even wanted to get I saved all my notebooks and I wanted to get in my notebooks last night and go through some stuff. Now I have to say, Dr. Myers, I don't know about statistics and research and methods if something pops out as significant, because, you know, I struggle.
You know, I hear that from people from time to time, but my argument is that it's seeped into your subconscious and you don't even realize. You don't even realize how valuable it is. It's just there. But I will say, as far as the accountability thing, it is good that you both mentioned accountability. I actually was, before I came in here to set up things for this, I was recording something for 601 and it was all about accountability. That was a big, you know, I mean, that's a big area of focus in the 601 class now. So that's still something that we hit. So it is good to hear that is something that resonates, because I do think that that's an important thing to carry forward, both as a professional and also as a citizen, to remember that, you know, as a government employee, you know, as somebody who works in social services or whatever area of public administration you work in, you're accountable to the people, but also as a citizen, you have to make sure that you're holding people accountable as well. Right. So I was glad to hear you both mention that. So the next thing is the most memorable, valuable information you gained from the MPA program. So if there's any, you know, and you both kind of talked about concepts, but if there's any like experiences or anything that stands out from your time in the MPA program that you feel like has had a lasting impact either in your work or in some other aspect of your life.
Dr. Myers is the only person to give me a B in the last 6 years. I will go down with that one. What else? Just Honestly, just thinking about all the work I did with the MPA program and with Dr. Myers and Dr. Bergbauer, Dr. Schmidt, everybody, I honestly I regret nothing. It's been the best thing that I have done. Dr. Myers made me think for myself. He made me research. He made me do the, SPSS, the Excel stuff, the stuff that I didn't like to do. And honestly, I'm going into my dissertation doing a mixed methods because of qualitative for him and quantitative with my PhD program. So it's doable. I promise, Claire. It's doable. But honestly, just listening to everything that the professors are telling you, if you want to work in administration, you want to work with the public, just take what they're saying and just use it and work with it. I will tell everybody Dr. Myers is, one of the mentors throughout my, college life the last 10 years, because he pushed me, he made me think for myself, and I was accountable for all the things that I did and I didn't do sometimes. But this program's great. The professors, just the atmosphere and like that familyness that they give you, that's what I'm going to say is I have nothing negative to say about this program. It's been great for me career-wise and, personal life-wise as well.
Claire?
I have to say that I at first struggled with some of the concepts of public administration because because there's a lot of political science and that's not really my background, but there's a lot of it that I could relate to, but I knew that I could do it. I knew that I had to do it for myself, because when I got through it, when I got that degree, that gave me a confidence boost that I needed for a long, long time, because I'd been stuck in a career phase for a long time and hadn't gone anywhere. And, I needed that. And I got it from that degree, and so I also admire Dr. Myers, Nathan. He always says, call me Nathan.
Right.
Too. But I wouldn't have got through that program without you. And you truly are an excellent teacher. And I can't say more good things about you. And I'm so glad you were there to help me.
All right, so we need to pivot so that it doesn't become I don't, you're gonna make me cry if we keep going down this road.
Yes, let's do it, Claire.
But I am gonna ask actually offline what class I gave her a B in. I won't ask her.
Two of them. Two.
Okay, well, I'll ask those questions after we're not recording anymore. So to kind of pivot then a little bit, thinking about the public administration program kind of moving forward, if we were gonna task public administration students or even like undergraduate political science and legal studies students to focus on specific challenges in the social services field, to do research in and try to identify potential solutions to, what kinds of things would you direct us to look at? What are the biggest challenges that you're seeing, and like what kind of research could either current master's students or undergraduate students, what kind of research could they do? What kinds of questions could they try to answer that would benefit you in terms of your work moving forward? So I'll start with potentially.
I would say maybe having research retention, burnout, and those types of things, like post-pandemic, those types of things, especially in the social services field. Like Claire mentioned earlier, at the height of my pandemic for my work, we lost 7 therapists and we only had 6 left. And so we are just now rebounding back from losing so many therapists. A lot of it was retention from burnout. We had to go from being in office to not in office within 24 hours. So retention and burnout. And then I would probably say pandemic policies. A big one is what they're doing now, how it could be improved, and those types of things. And even when it comes to, you know, like pandemic relief or like personal protection, those types of things, like those types of policies, they need to be revamped and relooked at because there's not a lot of prior research for policies on pandemic and those types of things and how to move forward and move past them, especially in like mental health or substance use, those types of things. That's a really big need for us, I think, right now. That's what I would say.
Claire, what about you?
So, you know, I mentioned mental health as being a really, you know, a crisis really in this country, I think. You know, suicide rates have gone up since COVID. And I feel like, you know, a lot of people turn their back. I shouldn't say a lot, but sometimes, you know, we get calls and, or people's reaction is to, immediately go to an inpatient unit. Well, there is only so many inpatient units, you know, so many beds for an inpatient unit. So I don't know, maybe they need to look at like how effective are inpatient units, or even like I'm trying to think. I always had tough times finding researching questions. I can see it in my head. Or maybe the rates of like the rates of suicide, do they go down with more? No, I don't know, Dr. Myers. I'm terrible at this.
No, I think you were on so I think you were gonna say like suicide rates among people who were in inpatient units versus alternative care. Is that kind of where you were going?
Yeah. Because there's just, you know, I mean, there's homelessness, you know, and I mean, there's just got to be something done for the mentally ill, homeless people. And so, yeah, so looking at those types of statistics.
Yeah, the homelessness problem is, I mean, it's certainly one that's very visible, I would say, in
Yeah.
Terre Haute and even in, you know, I live in Brazil, Indiana, which is a smaller town, just 15 miles. But even there, I think it's becoming more apparent. So how, just as kind of a side question, how big of an issue is homelessness in terms of the populations that you serve? Is that becoming an increasing issue? What are the drivers for that? You know, what's causing homelessness to become a bigger problem if it is becoming a bigger problem?
It is a big problem, especially in Edgar and Clark County. We are just now opening up to where we have homeless shelters, but it's a really big issue for us a lot of times because we're mainly mental health. On a weekly basis, I have anywhere from like one person a day up to two people a day who are sent to our facility from places in other facilities in Illinois, and they're bused down to us and dropped off to us. So it's a really big issue, but for my organization, we actually have case management, recovery support, and crisis services all available to where I can make the referral to get them housing, insurance, those types of things. But hands down, within the last like 6 months, I would probably say we have had probably close to 300-400 homeless people just trying to get services.
Wow.
Yeah, just dropped off at our building who are told to come and see us or new into town or they're coming through. But at least over 300 people within the last 6 months.
Wow, that's a lot of people.
What about from your position, Claire? Is homelessness becoming more of an issue, or is it just kind of consistently been an issue that you've dealt with over time?
We're seeing a lot more individuals with intellectual disabilities that are homeless than I've ever seen since for the last 7 years that I've worked here. I would say at least 3 or 4 individuals a month. Do we have oh, it's more than that. I would say probably 6 or 7 applications we receive monthly, maybe 10 that are homeless that just need a group home. Probably at least 10. But see, then they don't really want to go to a group home, but a group home's better than living on the streets. But see, there's rules in a group home, and they can't just leave by themselves. So they will stay for a few days, but then they'll leave. So see, group homes really aren't the best choice for some of our individuals when they find out that they can't just come and go. So
Ashley, you were saying that people are sort of getting bused to you or sort of directed to come. So where are those people? I mean, where are they being sent from, or where are they coming from?
A lot of them are mental health facilities, mental health hospitals up by Chicago. We have 3 up there that we work with. We have 2, we have 1 in Bloomington, 1 in Champaign. They get bused down to us as well. Majority of the time, if we have parolees from IDOC, and if they have nowhere to go, they'll get bused to us as well for us to give them services or have us like start the process as soon as they get out. But yeah, a lot of it is, I can't it's hard to, tell everybody how many individuals we're trying to serve and those types of things, but it's pretty bad. Like, it's pretty bad.
mm-hmm.
Yeah. Yeah, pretty bad.
So we're getting close to the end of my question. So anybody who's online and wants to ask questions, if you want to use your microphone and actually ask verbally, just let me know in the chat room, and I can certainly recognize you when the time comes. But if you want to type questions into the chat room, that's good as well. So just a couple more questions. The first one is there anything you would like to add that we haven't discussed so far that someone aspiring to be in your profession should know? So is there anything that we haven't talked about that somebody, wants to go into the social services, wants to do something similar to the work that you're doing? What should they know before going into that field?
It's not for the faint of heart. You're going to deal with individuals. My first day on the job had somebody to go curse at me and to go tell me to do something else. My first phone call of my position ever. You have to just take with a grain of salt. You can't just let a bad situation keep you down. You want to make sure that you keep doing this job. So if you go into this type of field, dealing with individuals who are at the worst of their worst, you just have to remember that you're just there to help them and it's not personal. I think probably the main thing that I've had to overcome is in this field, they're not mad at me. They're not cursing at me. They're just mad at the situation. They're mad at everything around, and we work with, disability individuals too, like Claire does. And so that's one of my favorite things is I love working in that building. So I would probably say is also just look for other avenues and other places for you to find work that you wouldn't think about. So I have a Claire at my job too, and she is an NPA student. She graduated with a NPA degree too. So you can find work in all sorts of different places, but just remember that you can still have a good heart, but don't take it personal. I took everything personal at first, and everybody hated me. I thought it was the end of the world. But now I get it. It's just them. It's the situation. And so just don't take things personal. That's what I would honestly just say. Have a thick skin.
Mm-hmm. Yeah, you definitely have to have don't take things personal in this field, because we see a lot of individuals that don't have anything and they're having the worst day of their life, and we could be the only person that could be helping them that day we see them, or we might be in the worst spot and just get yelled at them because we're in their way. So we can't take anything personal. And I've learned that through the years. It's taken me a long time to figure that out. When I was in my 20s, it was really hard to see that. But the older I've gotten, I realize that we're all human. We're gonna yell. We're gonna get mad if we don't get our way and stuff like that. So, and another thing with this profession is, I hate to say, I'm not in it for the money. There might be other social work professions that you can make better money. But I never looked at it that way, because I have always wanted to be a social worker. I always wanted to help people. Both of my parents were social workers, so I always saw them helping people when I was a kid, and I wanted to do what they did. And so here I am, and this is all I know. So, but I'm gonna, hopefully get a little, administration under my belt, which I have. And, I enjoy doing what I'm doing right now. So everything's good.
So the next question is, and when you answer this question, leave me out of it, okay? Don't tell me by name or anything, but is there anything so for somebody who's starting out in the Master Public Administration program, or maybe a prospective student who is thinking about going into the public administration program, what pieces of advice would you offer to somebody who is working on getting their MPA right now, or thinking about getting their MPA right now?
Do the reading. Do the work. That's the biggest thing. And that's what I would say. Do the reading, do the work. It may not make sense. Some of it may be like, why am I doing this? There were times where I felt like I was like, this is the silliest thing ever. But I have kept all of my stuff from my undergrad, my master's. Throughout my PhD program, I have constantly pulled out things that he who should not be named had us do in class and all sorts of stuff. So it's keep pulling stuff out, keep doing those types of things. And that's what I would just say. Stop mentioning him.
Yeah, I definitely had to get myself on a routine. I would work from 8 to 4:30, walk my dog, eat dinner, and then from 5:30 to 10 every night I was reading or doing, whatever, the program on my computer. I did everything online, so, well, except for 2 classes. But yeah, just structure. You have to structure your time and get on a routine. You're just not going to make it. You're not going to succeed, and you want to, because it's worth it.
Great, thanks very much. And I think both of those are good pieces of advice. But I think the time management piece, I think, is really important.
Yeah.
And I think that's the one that we all struggle with, time management, because unless we have a big deadline in front of us, or unless we have somebody, constantly telling us we need to get something done, right away, we tend to kind of get scattered among a variety of different things. So I think are good pieces of advice. I was going to ask, do the two of you have anything, either based on what you've talked about, or kind of, you've exchanged email a little bit. Do you have any questions for each other, or as far as, you know, the other's experience that you're curious about?
Where are you based out of, Claire?
Where?
Uh-huh.
In Terre Haute.
Since I have, so I'm just in Paris. I can
Uh-huh.
give services to clients in Terre Haute,
Okay,
and we
so,
could help because I could give you the contact of my Claire and my organization, and you guys might be able to like coordinate some services, and I could definitely do some mental health services and things like that for clients if need be. So, so you're in Terre Haute, really? I have never heard of this.
yeah. You never heard of the Bureau of Disability Services? It's a
No,
state,
ma'am.
it's a, you know, the state of Indiana, yeah,
No, I have never heard this from the Indiana side, and so, yeah, no, I'll be sending you an email and sending information to you and things like that as well, so I can try to help on our side if need be. But yeah, I had no
yeah,
idea.
definitely,
I had no idea.
definitely.
I mean, your office is
And so,
within walking distance from campus, right?
oh, yeah, yeah,
Yeah.
I was going to come to campus, but I have a 2:30 meeting and I needed to be, you know, right here for that, so.
Understand. Yeah, we have Zoom meetings on campus all the time.
Yeah.
When we can meet in person, but it's like, well, I got
Yeah.
another after that, so I better make it a Zoom.
Yeah, yeah.
But Claire, did you have any questions for Ashley or anything you wanted to?
Well, it's good. So you don't have to be a resident of Edgar County to receive services?
No, ma'am, so as long as my therapists are, as long as they have an Indiana license for therapy, they can do it between Indiana and Illinois now. And we
Wow,
do telehealth and in person, so we could coordinate services that way if need be, definitely.
because we get a lot of people that, I mean, do you take Medicaid?
Medicaid, Medicare, and we take almost all private insurance except for like TRICARE, which is like the military insurance, and we're in the process of doing that. But yeah,
You take Indiana Medicaid?
some of them do. I think I have one, at least one, if not two, who are from Indiana, who do take
Okay.
Indiana Medicaid. Yeah,
Okay, okay, good to know. Yeah, we
Yes,
can
ma'am.
definitely swap some information.
yes, ma'am, definitely.
Sounds good.
Thanks, Dr. Myers.
Yep, see,
See, this is
you
perfect.
you thought you were just donating your time out of the goodness of your heart, and it actually ended up being benefit.
Another resource.
So, anybody online have any questions? I wanna make sure, I don't wanna exclude anybody. I know, with things like this, a lot of times, just kinda wanna kind of listen and hear what people have to say, but I certainly, if people have any questions. I would. One other question I had, is whether you see any educational needs for people that you work with, people in kind of your area that aren't being met, that could be met. I mean, one thing we've been talking more about at Indiana State is like providing more kind of specialized like certificates or specialized classes geared towards certain groups of professionals. So, you know, are there any sort of educational needs in your area that you don't see being met, you know, by the public administration program or by other master's programs, that if they had a class on this, you know, this particular topic, or if they had a certificate in this particular area, you would take it or recommend somebody else take it?
Policy, just policy in general for social services, or policy of knowing like the rules and like even like HIPAA laws, those types of things, because with my staff is mainly reception and case records, and even though we deal with legal documents only, even though like we have to contact legal all the time just to get verification of what this policy says, just to make sure we're understanding it better. So maybe just on that aspect of understanding like HIPAA laws, those types of things where you don't have to be a therapist or in social work to be in our position, but just the laws, I'd probably say, and understanding them, because from like Indiana to Illinois and like different states is so different, but that's a big one for me in my position.
Claire, did you have any thoughts as far as that goes?
What about office etiquette?
That's so without without outing anybody or naming names or anything, like, what specific types of things are you thinking of when you talk about office etiquette?
Well, just, like how to properly send an email, how to um how to that's a big one for me.
Answer the phone is for me.
Answer the phones, how to do a meeting, like how to engage in a meeting. I have a really hard time getting my service coordinators to engage. I did a team building exercise the last week, and none of them wanted to participate. And you know me, Dr. Myers, I'm pretty lively, and so stuff like that.
You weren't having them do like trust falls or anything weird.
So I don't know. It's just a thought.
We do have a question in the chat. What was the transition like from being, oops, I lost the thing there. What was the transition like from being a frontline worker in social services to an administrative position? Good question.
Was that for me?
It's well, it can be for either of you.
Oh.
I think Ashley sort of kind of jumped into administration, but so we'll start with you.
Me or Claire?
Claire,
Oh,
sorry, I was gesturing towards Claire.
Oh, it was difficult because I hate to say this, but I did not receive much training. So it was kind of hands-on learning, and I also had to carry a caseload as the manager as well. So it was difficult, but I made it through. But now I'm, almost 3 years into it, but the transition was a little difficult. Just being honest.
Did you have any issues with, because presumably you were working with the same people, from, when you moved from more of a frontline position to an administrative position? Did you have difficulty like sort of with people recognizing that you were kind of in authority now? Was that an issue? Just how people saw you?
You mean the people I work with or the individual?
Yeah.
The people I work with?
I guess both actually.
Yes, I did. There was a little difficulty with that. But now, because they were my friends, and we couldn't really, they didn't see me in that authoritative role. And so I had to become more formal and in my approaches and how I talked with them, and not be mean, but I had to be more in control of how I responded to them from now on. And I learned that I couldn't talk to them like I used to talk to them. I mean, not saying we couldn't be friends anymore, but it was different. Like, it's different today than it was 3 years ago. It's just different.
Yeah, I think sort of maintaining, because you don't want to be aloof, but at the same time, you do have to maintain a certain professional distance, I guess, would probably be.
Yeah. Yeah. And it took a while to understand that and to get to that maturity level.
So
But
actually, what about, oh, sorry, go ahead, Claire.
no, I just said, but I get it. I get that I needed to do that for this role.
So I was gonna say, Ashley, from your experience, because you know, when you went into your position, you said you started as an intern, and then, so how did that transition work?
It was rough, I would say, going from HR intern to like a coordinator position where my staff is twice my age. Like my oldest staff, she is 78. My youngest staff, she is 47. So that was hard because I grew up in Paris. I went to school with a lot of their kids. And so that was really hard for me. Even still now, I've been in a position for 4 years. Having a much younger supervisor like me working with individuals, I find it hard for them to take me serious or find it hard for them to listen to me effectively. But I think that over the years I have proven that, you know, I can lead effectively, but it was rough, like Claire said. You know, my staff, we were in office the whole pandemic. My staff of 7 ladies, they were in office, locked in offices from. And so we were connecting calls. So we were literally the only ones in office. So I think that played a role on it as well, because they didn't have the talking to people and those types of things, but it was rough, but it's much better. It was, I went from school to an administrative position. So I've had to learn to lead effectively. That's been a really big thing for me, is learning how to be a leader. I didn't have the experience. I had to literally jump right into my position. So that's something I've had to learn over the years. I've had to take a lot of like meetings with senior individuals just so I can learn just how to be a better leader, how to do it effectively, how to communicate effectively. So all of those things I had to learn to do. Like I had that foundation to do them, but I had no experience in actually implementing them and putting them into practice. So that was probably why it was so hard for me to transition, because I was so green and new to it too. So that's probably a little bit cool, I'd probably say.
Very good. I appreciate you both answering that question so honestly, and thanks, Jennifer, for asking the question. It was really a good question. I did want to, and if anybody has any other questions, feel free to jump in. I did want to return for a second to what Claire had said about particularly the thing about, you know, how to run a meeting and things like that, because I think indirectly we kind of touch upon some of that in the MPA program in terms of like ways to avoid groupthink and you know things like that. So sort of more specific aspects of how to behave in a meeting and make sure that people are actually in agreement and don't just appear to be in agreement because they're not saying anything. But I do think that would be an interesting, if we could find some way to integrate that into like organizational behavior and things like that. And you know, effective, you know, do's and don'ts of effective communication and things like that. I think that would be interesting, and I think that'll become a bigger issue, because I think we're coming into a period where the way that people are communicating, we're getting into more of a period of like a generational divide, where like, just as kind of a silly example, like apparently now if you use punctuation in a text, it indicates anger or aggression to some. Is what I use punctuation and stuff all the time. Yeah. But like I was communicating with my 18-year-old sister-in-law, and I was texting normally, and I was using periods and everything. And she's like, you know, you need to relax. It seems like you're coming off as like you're mad about something. And I was like, I'm just writing as I normally do. So yeah, I think the communication aspect is probably gonna be kind of a challenge moving forward, because I think, and apparently some people, you know, like current college students and like high schoolers coming up, like actually like making phone calls is like a big deal, because they're so used to like texting everything that like making a phone call, like to anybody is a big kind of
Oh,
issue
yeah.
for some people, so.
Yeah.
So that'll definitely be, you know, a change, I think, for people moving into an office environment, and obviously, you know, having to, you know, because for me, like, you know, there's certain phone calls, like if you're making phone calls, you know, like if you're in an office and making a phone call to like somebody in like a elected office or something like that, that can cause a certain amount of anxiety, but it just kind of seems like a general thing now, so. So I just wanted to say those are good suggestions that you made earlier, so.
Okay.
I will take that under advisement. So anything else from the audience, or anything else from you two, Ashley or Claire, anything you want to add?
I think I'm good.
Anything I didn't ask that I should have asked? But I do, I really do appreciate Ashley and Claire joining, and those of you who joined us online, Christopher and Jennifer, I appreciate you joining. And you said some nice things about me earlier, and I will say that one of the reasons why I wanted to do this is that as I've sort of been keeping track of our graduates more over the last few years, I've been very impressed by the fact, you know, the diversity of work that our students do, the diversity of fields that they work in, the fact that so many of them hold, you know, high-level administrative positions, leadership positions in those organizations, and have been progressing, you know, pretty steadily over the years. And have done some really impressive things, you know, since they've, you know, left the program. They've done some very impressive work. So, you know, one of my things is, you know, I do want this to be an opportunity for people to learn about potential career avenues that they can take, and getting some advice about how to do that. But I also want to highlight the good work that our graduates and our students are doing, because it's really something that doesn't get highlighted enough. You know, we get so caught up in our like day-to-day of like doing our classes and things at the university that we don't always stop and appreciate like that our students, while they're here, are doing really impressive things, and then they're going off and doing really impressive things. So I appreciate all the work that you do. Claire's office, I've actually had some personal experience dealing with, and they were actually one of the easiest like government offices I've ever had to deal with, in terms of, you know, going in, you know, being told what we needed to do, getting things processed, and actually like getting the services that we needed. Like it was like, I was really shocked by how smoothly everything went. Just from the standpoint of, you know, I expected there to be more of a wait time and stuff like that. So I can personally attest to that, and I haven't had occasion to deal with Ashley's office, but I am confident, given that she's been in her position for quite a while now, that she is doing very good work in her position.
Just don't get a DUI in Indiana or Illinois, or need services for mental health, you won't have to come see me.
All right,
Don't
well,
do that.
good reason in place anyway, so. All right, so if there's nothing else, thanks everybody for joining, and we will be doing several more of these over the course of September. So if there's any other ones that you're interested in, I'll be sending out reminders, and I've made announcements, I think, in all of my classes, so you should be able to find it somewhere. But if you have any questions about upcoming panels, let me know. Otherwise, thanks everybody, and have a good rest of your day.
Thanks. Bye-bye.
Thank you.
Thank you.